background, but I'm not sure what's going on there. Um, so, look, apologies, I'm at work right now, so I couldn't really look into the IT logistics. Um, at this stage, we are just trying to ascertain if it's a webinar and whether you can be allowed to talk or present or open up your videos. So hopefully we should be able to look into it. Not sure exactly when and how. So let me introduce Dr. Kiran and Dr. Mariam. Now, Dr. Mariam, would you like to just do your introduction quickly?
Yeah, sure. How are you, Dr. Rizwan?
I'm great, thank you.
I'm Dr. Mariam Tanveer. I'm an IMG from Pakistan. I have over 5 years of experience in medicine, and I have joined Emergency Focus since 2023. I have attended a couple of their workshops, one of them in person in Sydney, Liverpool Hospital, Australia, and I passed my AMC MCQ exam in December 2023 on my first attempt with their assistance. And also, I joined them for AMC clinical preparation, and with their support, I was able to pass my AMC clinical in my first attempt in June 2024. Since then, I have passed my PESCI interview as I have secured a job in a general practice setting. And while waiting for my previous provisional registration, I am doing a systematic review with California Institute of Behavioral Neurosciences, and I'm also doing in some diplomas with College of Physicians in Ireland. So I will be your tutor in emergency focus for AMC clinical preparation, and I will try my best to support you as much as possible.
Excellent. That's a lot of life, Dr. Mariam. That's a lot of life which is happening. But the best part I like is that we've been able to pass both exams in first attempt. Dr. Kiran, please, just have to unmute yourself.
Hello, Dr. Rizwan. How are you?
I'm good, thank you.
Okay. Hello, everyone. Welcome to Emergency Focus. I started this journey 2 years back, and I was not sure whether I'll be in Australia or not. So I passed my MCQ exam in June of 2 years back, and then I joined Emergency Focus for clinical preparation. And I cleared my AMC clinical last year in July, and it was all online till that time. This face-to-face thing happened just recently again. And the one thing that emergency focus taught me very clearly was uh, you have to be confident, present, and very precise and clear in your communication. So the clinical exam is all about communication. You have passed the first stage, and that has proved beyond doubt that you know everything. So your knowledge is not the
Okay.
issue here. The issue is that how do you communicate that knowledge to the patient, and how you assess them, and whether you are familiar with the protocols of their country, because that is where we all lack. We become judgmental, we treat them like as we treat our patients, but things are different. The level of communication, the approach to a patient, the formalities before we start behaving as a doctor, they are different here. So we have to, like, this is one concept that the gist that I got from past 1 year was we have to be non-judgmental, treat them as human, nothing less and nothing more. So leave your religion, leave your ethnicity just aside, be a doctor, talk to them in a way as if what you are expecting from them as a patient. For example, if I am there for, say, some illness, so when I enter the doctor's room, there are some expectations. I want to know what is happening. I want to know whether it is serious. I want to know what to do next. So take your history and talk to the patient in a way that you are able to answer these questions, and you will be
Mm.
through.
Yep,
That's it.
that's excellent. And look, I won't take most of your time because I believe both of you have got some very important cases to discuss. I'm at work, so I better get back on the floor. That's a little hindsight on my part. But one thing which I'd like to say at work today, we've got three IMGs working with us, and they have been able to obtain a job. One is from India, one is from some Arab countries, and one is from Pakistan. And this is just an internship. They're working with me today. I'm a living embodiment of that they are able to secure a job after. So talking to them and dealing with these IMDs who have come to know very well is that there's a reason that they've been able to work here in Wollongong Hospital and just in cafeteria right now. If they're able to pass their AMC exams, including the AMC clinical and secure a job, and now what's considered to be one of the best hospitals in New South Wales, then you can too. Often there's a lot of stigma around AMC clinical being difficult. And I think that stigmatization makes it even more difficult for people who can genuinely pass that. I distinctly remember Dr. Marian, that she kept everything so simple throughout performance. She was very regular, always had the camera on, and she kept it simple. She just was able to replace, not replace, sorry, mirror the teaching that she had and was able to say out with a lot of courtesy, a lot of simplicity. And I think that's where that balance is. And trust me, it is a hard process. It's not that on day one you'd be able to just do everything as you can. It will take practice. And for that practice, you have to be regular. I can assure you and I can personally guarantee you that Dr. Mariam and Dr. Kiran are the best tutors you can get. We're only doing an evening course, so they will look after you and they will support you throughout the process. And I'll be there as well. We'll be also exercising just as AMC1. We'll be doing some other workshops. Um, and we'll be also doing a specific communication skills workshop pertaining to AMC clinical plus additional radiology and ECG workshop related to AMC clinical just as AMC1. Plus, we'll do a career guidance session just to make sure everybody's on board. So plenty of good things. And I look forward to seeing you as many as possible. And over to you. And Dr. Sarah, who will be our administrator. So please divert all your attention queries to Dr. Sarah, who has very diligently been behind as an administrator for most of the RNC courses. And she will be your point of contact. And obviously, you can always send an email to info@emergencyfocus.net. I'll leave you to it. I better get on the floor. I've got a lady, interestingly, today with a right upper quadrant pain. I was like, very easy. Oh, this is lady, 53, right upper quadrant pain, dull, postprandial, it's got to be gallstone. But the plot thickened when she told me, no, I had a cholecystectomy back in 2021. So now I've just sent her for a scan. I did a bedside ultrasound scan. And then she told me that I've had colitis. And then she told me she's got Bartter syndrome. So the point that I'm trying to make is that it's all about differential, keeping the patient comfortable and safe. But I'll keep you an update, give you an update, hopefully, at a later time, if I can, about what happened to that patient. Okay, over to you, Dr. Sarah. Nice to see you, Dr. Mariam. Are you still in Qatar or you relocated now to Australia?
I am still in Qatar. I am waiting for my registration to be finalized, and then I will land up in Windsor soon.
Wonderful, wonderful. Windsor is a very good town. It often gets flooded, so just please make sure when you get a house near there, it's on a higher ground.
Okay, thanks for
All right,
that.
right.
All right, so participants are here with us, and I'm just going to introduce myself. Dr. Rizwan has already. I'm Dr. Sairaza, and I'm the managing director at Emergency Focus, and I oversee all the courses that has been running from the platform of Emergency Focus. So just in case all the participants, if they have any review, any suggestion, any feedback, and I would be glad to look into that. Okay, so let's get started. Just give you a brief description about what AMC clinical course via Emergency Focus is. All right. So the sessions are every evening. They are from 7 to 10 p.m. Sydney time. And you all, whoever registers with us, they are going to be shared a live timetable. It has got the tutor's name, the date of the session, and the topic, so that you come prepared by reading through your pre-session notes.
And as I said, that the PM group has that timetable for the dates and the time for the and if there is any change, you will all be joined via the WhatsApp group. So if there's any change or any last minute changes, so that would be announced on the WhatsApp group as well. But it doesn't happen. But just in case for any last minute or some quick exchange of messages. Okay, so an email would be sent to all the participants to join the group and also how to join the AMC portal. Right. So this is very important. So all the notes and videos and timetable, they are for personal use and they are marked by IP, your IP address, right? So any breach, any sharing of that course portal or the notes, it would be flagged by our system and you would be barred from accessing the portal. And the bad news is that we won't be able to help you much with that if it's identified as using multiple IPs for the portal, right? So instructions will be sent to all the participants and you'll have the access to the portal for a good 6 months. So even after the course ends, you will be able to revise and prepare for the upcoming examination. Right. So AMC clinical and jobs. This is it. This clinical AMC course, it saves your time. It also addresses all the gaps. If you have any clinical gaps of knowledge, it addresses that. And you have to apply for the, it helps you. We also, after you pass this AMC2, then we also help you with the job applications. And the time for AMC clinical preparation is around 4 months. Okay, so the course time is 12 weeks, so it makes up to 4 months, and there are CPD requirements as well. So this is how your AMC portal looks like. You'll be having 6 months access. Videos are, I'm sorry, this is not AM, just the PM sessions now. And further extensions, if you require any further extension to your portal, if you think that you are not well prepared, then you can request for an extension of the portal and we'll be happy to do that for you. Okay, and trust me, portal saves your time. So how to prepare for the sessions. So you go through the portal session numbers. Okay, so they would match exactly on your timetable. Go through the pre-session notes and go through the guidelines below the videos. And there would be 8 sessions and there would be 8 role plays and there would be feedback. So I would request Dr. Kiran to explain it a bit further, how she does that live during the session. So she would be able to help me with that.
Yeah, actually, what we do is it is the live role play session. So
Mhm.
we have 8 cases for each session, but I usually take 10 or 11 cases. Then one of the candidates will be role playing, and the other will be the doctor. And once the role player, they get 2 minutes for reading and 8 minutes for performing. And after that, I'll just tell you what you can improve, how did you score, what were the points for which you will be assessed during the AMC, and then I'll give you some brief overview of that subject, of that case in hand. And this is how it goes. So you will role play there and then. So you will lose that inhibition, that inhibition of speaking. It's a great obstacle. And when you get the feedback, you can know exactly where you were lacking, whether it was your communication skill, whether it was your time management, whether it was your knowledge, whether it was your approach to the patient, whether there was some lack of empathy, whether there was some other issue. So you'll get a detailed feedback for each case, and then you can improve upon those aspects and then perform better next time. This is how it goes during the sessions.
So would you like to highlight about the trial exam at the end of the course?
Yeah, we offer trial exams and they are one-to-one. So I'll be the role player, you will be the doctor. And after trial exam, we'll give you written feedback, detailed feedback after the exam ends. And it is just like the exam scenario. So you'll feel the pressure and it goes exactly as the session jumps in the exam, and it will prepare you best. You get to know how the exam feels like and push you, in a better way towards the exam.
Okay. So the common questions, frequently asked questions, how to access the portal. So there would be an email sent to every participant who registers with us. So make sure you check your spam folder as well, because sometimes it drops into your spam folder and we keep getting the email that they haven't gotten the email for to join the portal. Okay, so the session timings, as they have mentioned earlier, it's from 7 to 10 p.m. And how to register, this is the website from where you can register. If you're unable to attend the session for your work or some other reason, so all the video recordings are uploaded on your portal within 24 hours, if I'm not wrong, Dr. Kiran. So they are all uploaded within 24 hours, along with your notes there already on your portal. So all participants will be provided with the certificate of completion. Okay, and we require 100% course completion. That would be automatically on your portal. All right. So how to plan for your emergency AMC clinical exam? So would you run through this, Dr. Kiran? The books.
Yeah, sure. So what we have is we have 16 stations. So in face-to-face exam, as Dr. Mariam was telling, so we have 16 stations, out of which two are not scored. They are pilot stations, but we don't know which ones are that. So that is on the assessor's discretion. So we have to aim for all the 16 stations. Earlier last year, it was the criteria was for 10 stations. Like you have to pass a minimum of 10 stations to pass the exam. But now it has been reduced to 9. And on an average, we need like 3 to 4 months to prepare for this exam, but that requires consistency. So you have to be regular, and that requires live, communication and feedback. So it is not a one man's game. You cannot just read in a room locked up and then pass the exam. You have to speak, you have to practice. Then the AMC Handbook of Clinical Assessment, it's a bit old, but it's still good. So you can go through like what kind of cases come, what are the topics that they touch frequently, and what do they expect from you. So you can go through it 2, 3 times and you can get a feel of what they require from you. J. Mutag is obviously the book for reference. And for physical examination, Telio Corner. They follow Telio Corner tip to toe. I mean, you have to read this book at least once and then practice according to it. All the references and all the points in physical examination, the manner in which physical examination is done, the structure of the physical examination, they all take it from Telio Corner. So you have to study in the real exam conditions from day one. So you have to have a study partner, which you will get in the WhatsApp group that will make for you. So you can just choose 1 or 2 study partner, and then you can go online 3 to 4 hours a day, sit with them, make a tally sheet of all the cases from the past 2, 3 years, and then practice according to that. So if you target say 10, 12 cases per day, and then you are doing 8 cases for each session with us also, and you're getting regular feedbacks, so it won't be as tough. So study group is very important, and it will be automatically formed on the WhatsApp when you join this course. And there are many videos on the emergency focus portal. The previous classes, you'll have access to the previous sessions also, the AM sessions and the PM sessions also. So before you come to the class, you can just pull those videos out. You can go through them. You can see how the previous participants have performed, what feedback did they get, where did they miss, and then you can come prepared to our live sessions, and then you can get a feedback from us. So in short, you get access to the real exam conditions, because 8 sessions each class we are doing for the participants, and they're role playing. So you really get that feel that how actually it is done. So you watch in those videos for 2 minutes, they're thinking, they're jotting down their points, and then for the next 8 minutes they're performing, and then they're getting the feedback. So it's kind of a revision of the exam scenario.
You want to add anything else? That's all. Okay. All right. So the course organization. Right. So would you like to go through this, how the course is? I think we have discussed about that.
Yeah, we
You want to
discussed
add
about it.
anything to this? Okay, so there are 8 candidates role plays, and they are going to perform. They are going to be performing live, and you all are going to be getting the live feedback from the examiner's point of view, from your tutors. Okay, and the last 20 minutes they are open for Q&A. Okay, so how do you do a scenario? Please, Dr. Kiran, you're going to have a go.
So in the exam, you'll get a 2 minutes reading time, but when we practice in the classes, we only give you 1 minute, so as to make you a bit, resilient to the exam conditions. Then in that 1 minute, you have to read the question, understand the gist, and then jot down in your mind what are you going to do in the next 8 minutes. So this is basically a preparation time for the next 8 minutes. So you have to read the stem, you have to make a provisional diagnosis in your mind, and then you have to enlist the differentials, and then you have to structure your history or whatever you want to do in such a way that you are able to get to the required answer for that station in the next 8 minutes. So the first 2 minutes are very essential, and if you are able to follow one structure through all the stems, it saves a lot of time. It helps you tackle the pressure during the exam conditions, and the next 8 minutes will be organized in such a way that you are able to finish the task in 8 minutes. See, if Dr. Rizwan used to say this actually, if we all get 20 30 minutes for each station, no one is going to fail. The problem is that we only get 8 minutes and we have to perform in those 8 minutes. So this is the test actually. We all know everything, we all have good knowledge, we all have passed out with great marks, but how to use those 8 minutes to compress all that knowledge, to extract a history from the patient, and to explain in a layman language to the patient, that is what this scenario is all about. So, this is how you do a scenario. So, 1 minute you take to thoroughly read the station. Then, next 1 minute, you design the scenario in your head that for the next 8 minutes, I'm going to introduce myself in 30 seconds. I'm going to take the HOPI in the next 30 seconds, and then I'll to ask the differential questions in the next so many minutes. These will be my differentials, these will be my questions. And then in the last 2 minutes, I'll be explaining to the patient whatever what needs to be explained. This is how we do a scenario.
Okay, thank you. All right, so now I would like to ask Dr. Kiran to go through the new structure of AMC clinical exam. So please run us through what it is about and what's the hype all about. Over to you, Dr. Mariam.
Yeah, sure. So for 2025, as all of you know, that the new exam format will be face-to-face only. So there are slight variation. The exam duration will be 3 hours and 20 minutes instead of the long 7 to 8 hours. It was a quite exhausting exam. I remember in June 2024, we were sitting and we were not allowed to talk, or we are not allowed to speak as well, move around as well. So the exam stations, number of stations will be 20, and 4 of them will be the rest or break stations. And 60, you will be assessed on 16 stations. 14 of them will be scored, and 2 of them will be non-scored. As Dr. Kiran has already explained, that it's not our job; it will be the job of the AMC assessors that which one of the stations will be the scored ones. So our aim is to prepare as much as possible for all of the 5 modules, which are medicine, surgery, obsgyny, peds, and psychiatry, and we will prepare you at our best for all of them. They can all come as a history taking case, they can come as the counseling cases, or they can also come as examination cases. So you should be prepared well for them, and we are here to support you for your preparation. Regarding the assessment methods, they can be any. They can be simulated real life patient, which is standardized patient. It can be telephonic consultations, because sometimes in rural settings, we can get a phone call from a rural area, in a remote area. So it can be a video patient cases or models as well, because of the telemedicine, which has been so common these days, and the medical equipments as well. You will be assessed on data interpretation, including chest X-ray, ECG, spirometry, and the lab investigations. So we will prepare you for that as well, because there are I know the medicine is the same worldwide, but the healthcare system is different from country to country. So we want you to get prepared for the healthcare system in Australia, and this is the purpose of AMC exam. They want to see that how well you can handle the patients in healthcare systems in Australia, and how well you can communicate with them. As Dr. Kiran has also stressed the importance of communication. So we will work on your communication skills, including the soft skills, empathy, how to show the empathy, and how to be non-judgmental. Because some of the scenarios are quite sensitive, and you have to be very non-judgmental and empathetic in those cases. So apart from that, we will also guide you about the technical stuff. As Dr. Kiran has already explained, that you have to build a structure in your mind, and there are certain useful mnemonics to prepare for them as well. So we will guide you how to approach each and every case step by step as we move forward with our course.
All right, so that was very, very good introduction into the new structure, how the new AMC clinical exam would be like. So that was very insightful. I've been seeing many candidates, many participants of this webinar who want to ask something. So I would like to say that the Q&A session would be at the end of this webinar. All right, so just keep writing your questions, and we'll take your questions at the end of the session. All right. Mani.
Next come, what are the top 5 tips to ace the AMC clinical exam with high score? So I would recommend that stick to these tips as much as possible. First of all, follow a structured approach. As Dr. Kiran has already explained, that make a structure, build a structure in your mind, that you have to start with the introduction, and then you have to build a rapport, and we will guide you how to build a rapport with the patient. And you have to be an active listener as well. Because if patient is giving you some piece of information, it will save a lot of your time, and you will skip the questions, and you can move on to the rest of your history, and you will build a history structure in your mind, and also for the same structure for the physical examination as well, and we will guide you for that as well, and it will come with practice. As Dr. Kiran has also emphasized on the importance of practice, and that is the main purpose of our course, that we are trying to expose you to the exam environment in 2 to 3 hours, and you will be presenting 8 cases. So it will build up your stamina for the time management as well, for the exam environment as well, and it will help you overcome your um, hesitance or reluctance to exam situation. So I always say that stay all structured and practice under exam condition. Practice as much as you can, even after the classes and before the classes. Join a study group, make a habit of doing practice with a study partner. If you get a study partner from the same group, from, like, for example, from the emergency focus, if you are our students, so it will be great. Before coming to our sessions, I would highly recommend that go through our slides on the portal and the videos on the portal, and bring us the questions for us before, and come prepared in our sessions. Because once you are prepared, and you will get a constructive feedback on your performance, you will never ever miss that in your exam. So I highly recommend that when before coming to the our sessions, try to practice with your practice partner, and then get our feedback. Master Australian clinical guidelines. So as Dr. Kiran has also guided you about the guidelines, like the one is AMC handbook, the other that is outdated, but still it will give you a good idea of how to approach the cases, what are the red flags which should not be missed, what are the critical errors which are very high yield to pass the exam. If you miss them, the chances of passing the cases will be quite low. So we will guide you what could be the critical errors. Let's suppose in case of a shortness of breath, or in case of cough, it will be a critical error if you miss to assess the position of trachea. It's really important. So I will guide you step by step as we move on to the rest of the cases. Next is enhanced communication skill. So this is one of my most favorite component for exam preparation, because I feel that if you win a patient, you will be the winner of that case. And in certain exams, there is a feedback fact sheet for the standardized patient as well, and they have to give the feedback that do you want to see this doctor again or not. And I always used to put myself in my patient's position, so that if I am in pain, or if my child is in pain, how I will react in such scenario. Like if I will be going to see a doctor, and if my doctor is showing a lot of empathy to me and taking care of me and my son very well, I will always go for that doctor. So just keep that thing in your mind, and it will come out as natural. And it you I we will prepare you to practice as much as that you will in the end you will be practicing like natural communication. So I would always emphasize on to stress on the communication skills and intonation as well. What is the intonation? Like you can raise the tone of your voice whenever you want to stress on something. You can make the tone down when you have to break the bad news. You have to you have to change the tone based on the situation. Moreover, I always say that try to be as non-judgmental as possible, and we will advise you how to do that. Next is manage time efficiently. It's really critical. And Dr. Rizwan, I also remember he used to say us that if I give you a case for 20 minutes, all of you will be doing great in the cases. That's why you have to be very time efficient, and that's the purpose of the practice in our session. So we will prepare you what are the key points, what are the important points to be asked in each and every case, and how to tailor the history structure based on each scenario so that you can manage your time quite efficiently. So next is top 5 management strategies, for example, for 4 to 5 months. I would always recommend that don't track exam preparation more than that, because it will drag your stress duration for more than 5 months. And nobody can take a stress of an exam, I'm sure, for more than 6 months. So I would highly recommend that don't drag the exam timing too much. 4 to 5 minutes are good enough time for preparation. And if you are stay to our course, I'm sure that you will be doing great, because once you are join our course, our sessions will be every Monday and Wednesday for 2 to 3 hours, and the rest of the week you will be free. So in your free time, you can practice with your practice partner as much as you can, and you will be having the access to the portal as well. And so you will have plenty of time for your own practice, and you can contact us as well in that time, and we will try to provide you maximum support during that time. So I would highly recommend that don't drag the preparation time for more than that. Number one, prioritize your task. If you feel that you are weak in any module, for example, mental health, some of you are weak in ops and gynae, so you should take more time for those modules. Number two, time blocks. Same thing, that if you are thinking that you have some weak areas, some counseling areas, you should practice more and more on those cases to overcome the fear of those cases. Number three, practice pacing. This is the same. Just see how many times we have used the terminology of practice. This exam is all about the practice. All of us are very good in technical knowledge in medicine, because all of you have passed AMC MCQ, and some of you have passed it recently. So it's very you are most of you have very good set of knowledge. But how to deliver, how to apply that knowledge is matters a lot in this exam, and we will guide you in for how to communicate and how to do that in your exam. Just checklists. Checklists are very helpful, as I already told you that there are very useful mnemonics for each and every case. Let's suppose for adolescent cases, we have a different set of mnemonics. For peach history, we have a different set of mnemonics. And for some specific differentials or symptoms, we have a different set of mnemonics. And these checklists will save a lot of our time, and they will keep us on track. They will not let us defocus during our exam as well. Next is stay calm. Yeah, it comes it's very important, it's really very important, it's very hard to overcome it. So we will also guide you about the relaxation techniques. I was using deep breathing exercises few hours before my exam, just to keep myself relaxed as much as possible. And you can also use in some enroll in gym as well. I would say it because you can go out for a walk as well. Just try to save some of your time for yourself as well, so that you can stay calm before your exam. And take plenty of rest and plenty of food before your before your exam as well.
Okay, so how about we
Number next.
these slides before we go jump on to the real cases? So give them a
Yeah, sure, sure.
so how about you go through these slides quickly?
Yeah, sure. This, I think they have been already discussed by
Already
Dr. Kiran. So I will just quickly go through them. So how to effectively utilize your 2 minutes time and 8 minutes time. So this 2 minutes time is critical, and Dr. Kiran is right. We will give you 1 or 1.5 minutes time, not more than that, because of the exams time limitations. In real exam as well, I guess you will be given 1.5 minutes only. So you have to identify the task. First of all, identify, it's very important. Sometimes you take the history and it's not written. Sometimes we take the to go for the counseling and it's not written in our task. So just be very, very careful about your task. Sometimes it's written that do focused and detailed examination, and some candidates think it's a focus history and detailed examination, and they start taking the history. So be very careful about that. Regarding the scan key details, what are those details? Which is patient's age, gender, symptoms. It's very important because some diseases are quite prevalent in some ages, right? And the setting is really very important. If you are in a GP setting, you have to introduce yourself as a general practitioner. If you are in emergency setting, you have to check your designation, whether you are a medical doctor or a junior doctor or a registrar, and whether it's a hospital or it's a GP setting. So it's important to have a look at that as well. Form a quick plan in your mind, that is already told by Dr. Kiran very well. Watch for traps, which is hidden diagnosis, ethical issues, red flags. Red flags are very important for each and every case. Rehearse your opening line. Yeah, before entering, just rehearse your opening line, just so that you can overcome the stress of the case. Regarding the 8 minutes exam time, Dr. Kiran has already told it very well. So you should allocate your first 1 minute for introduction, confirmation of the patient details, and build rapport, and we will guide you how to do that. Next 2 to 3 minutes, take a focus history, prioritizing key symptoms. So how to do take a focus history, we will guide you about that based on each and every case. Next 2 minutes, perform a targeted physical examination or verbalize if short on time. And next 2 to 3 minutes, we have to explain diagnosis, investigations, and management in simple terms. We have to avoid medical jargons because we are communicating with a patient. Final 30 seconds, we have to summarize, check patient understanding, and this understanding is really very important in counseling sessions. We have to involve our patient actively in our discussion. And what is safety netting? Safety netting is about education of the red flags. So we will tell you how to do that and in where to do that. And thanks them. Always, I will in the physical examination, I will guide you how to do that. That we have to cover up the patients and say thanks to them for their cooperation.
So this is the tip for the high scorers.
Yeah,
So there's few of them who
yeah.
score very high. So just briefly go through this.
Yeah, they are almost similar, but one of them is stay structured and time aware, use clear, empathetic communication, prioritize patient safety, and best practice management. What do they mean by it? Best practice management means we have to be very safe. We always have to mention, if we are a junior doctor, that I am going to discuss with my supervisor or I am going to discuss with my senior registrar and seek their consult as well. So avoid jargons and keep explanations very simple, and we will guide you how to do that. Practice under timed conditions to refine speed and confidence. My AMC clinical examination journey, I guess I have already explained it. So it was not easy, it was intense but rewarding. Over 5 months, I focused on consistent practice, positive mindset, and peer support to achieve a high score on my first attempt. My experience with emergencyfocus.net was invaluable in refining my skills, and I'm grateful for the support that helped me excel in AMC clinical examination on first attempt. Good luck with your preparation. So I used to practice in the exam. I used to, as Rizwan always to mention that I was very regular. Yeah, I missed only 1 to 2 sessions, and I was regretting because of the time zone difference. I used to wake up in the middle of my night to attend the AM sessions and get the constructive feedback, especially from Dr. Rizwan, because he was only in the AM sessions. So that's why I was very regular, and I highly recommend all of you to attend the sessions live if possible. If for some reason you are not able to attend the live sessions, the recording will be provided to you. But I think if you'll go through the recordings, you will be able to um, uh, grab only 20 to 30% of the knowledge. So it's best to come to the live sessions, practice, see the performance of others as well. It will also help you a lot in your real life exam. And the main purpose of our course is not just to prepare for you for the exam, it also will also help you in your future practice as well. And we all want you to see you here in the system soon. So practice again, I have emphasized the importance on the practice, stay positive and support each other. That is really very important. Surround yourself with positive people who give you positive energy, and stay away from the people who are making this exam a horrible. I also came across some of people who were saying that this exam is quite tough, it's really challenging to pass it. Some people are not able to pass it even in their 6 attempts. So try to stay away as much as possible from such people and try to support each other. If Because if you are supporting at this stage, in your learning stage, it will be help it will be very helpful for you. Really, I promise with you that it's really helpful. If we support each other, some of our actions will be rewarded in any way. And I believe in that. Aim high, aim to score high. Always wake up with the thought of passing the exam with high scores. I Every morning I used to wake up and I was saying that I have to do it at any rate. I have to pass my exam at any rate, and I did it. And follow structured approach and follow the guidelines. We will guide you about the guidelines for the medicine cases, RACTP, for management part therapeutic guidelines. These are same which we have already used for AMC MCQ preparation. So now move to our first case.
Okay, I'll see if any of the participant can join us. Let me check. Okay, if somebody wants to join the live one-on-one session, they could raise their hand and I would allow them to participate with us. Is there anybody who would like to join? Okay, Dr. Right.
Bhuvanesh.
Okay. Right. I would allow you to talk and participate live. So yeah, Dr. Mariam, we have got a doctor. Can you talk and let's check the mic first?
Hello.
Great. Great. Yes, we can hear you, doctor. Yeah, so
Yes, doctor. Thank you. Thank you for allowing me to participate.
no worries. It's our pleasure to give you the real feel of how the course is like and how your exam would be like. So, Dr. Mariam, over to you. Your case,
Yeah, sure.
present your case to the candidate.
Okay. So I will give you 1 minute. Are you ready to practice this case? I will be your assessor in this case.
Okay.
Okay, that's great. So I'm going to give you 1.5 minutes of reading time. Just take a time to have a look at your task and your case, and then I will be your patient in this case.
Okay.
Your time starts
You want
now.
me to read the case or?
Whatever suits you, if you want to read the stem, you can do that.
Okay. A 55-year-old man, Mark, had history of exertional dyspnea and dry cough for 2 months. He visited your GP practice last week and spirometry was done. He has now presented to discuss his spirometry results. So the task is to explain the result to the patient in 2 minutes and take a history to support the diagnosis. Okay.
Mhm. So I'm going to give you 1 minute of thinking and work on your task. So and think about your task, and then we can move on to the case, right?
Okay.
So now I'm going to start your 8 minutes time. Are you ready?
Yes, ma'am.
And okay, that's good. So your time
But
starts now.
actually, I can't diagnose what's wrong with this patient except for the fact that his FEV1 by FVC ratio, the percentage is a bit low.
Okay, move on to the case, explain the results, and I will get back to you. I will provide you the details and how to interpret the results. That's the main purpose of this case. That all right?
Okay,
It's okay if
okay,
you can make mistakes here rather than making the mistakes in the exams. And I'm very glad that you have volunteered yourself for the presentation case. It's you have done a brave job already. So just don't worry. We are here to support you. Okay.
okay, okay,
So your time starts now. I'm going to give you first 2 minutes time. You have to explain the results in 2 minutes, and rest of your 6 minutes will be for the history of the case.
okay. So
Mhm.
first, I'll start by introducing myself to the patient and make sure that he's in a like a private place where I can discuss the results with
Mhm.
confidentiality.
Mhm.
So moving on, I'll tell the patient that his there is some problem with his lungs. So um, and his Fe V1 by FVC ratio is a bit low even after the bronchodilator test. And well,
Mhm.
I can't find what's wrong with this actually. I can't diagnose
It's
this
okay.
first.
That's fine. That's fine. Now we
Yeah.
will move to the next task. Just start with your history taking.
Okay, so
That's fine.
history,
That's totally
I'll
fine.
okay, so history, I'll start with the chief complaint, why the patient presented. I'll ask him like
Take history from the
what.
patient. I'm your patient. I am Mark.
Okay, okay,
Okay.
okay,
Hmm.
okay. So hi, Mark. I'm glad that you had come to me, visit me for your uh, your breathing problems and your cough. So may I know when this started for you?
Yeah, doctor, it has been 3 months. I am having this dry cough and I have some shortness of breath. I can't walk up the stairs, and it has been ever getting bad since last 2 months. That's why I visited your GP clinic, and they did some test, and it was some kind of breathing exercises with a device. And now I came here to discuss the reports with you.
Okay. Do you have any other symptoms along with what you have said me, like any fever or anything else?
Last week I was feeling a bit hot, but I did not check it yet.
Okay. And have you tried anything which could relieve this?
Only I took the over-the-counter cough syrups, and they helped me with the symptoms, not too much extent. That's why I came here.
Okay. And any other thing which makes it worse except for, when you move around?
Yes, I whenever I walk, as I mentioned that I when I climb up the stairs, it gets worse.
Okay. Okay. Thank you. And may I know about your past history? Like, do you have any other diseases which were already diagnosed with?
No, doctor. I was operated for appendix when I was 20, and apart from that, I don't have any medical condition.
Okay. And what about your family? Does anybody in your family have had this something similar to this or any other conditions that you know about?
Yeah, my father had a heart problem at the age of 65. My mom was having diabetes, and
Okay.
apart from that, I'm not aware of any other condition.
Okay. And what about medications which you use?
Mm, medication, I just use the cough syrups from the shelves. Apart from that, sometimes I take the vitamins, but these days I'm not taking anything.
Okay. And do you have any allergies?
No.
Okay. And is there anything else that you would like to tell me regarding this problem which you have?
Yeah, doctor, I'm worried. Is there anything serious going on with me? Because some of my friend told me that his friend was diagnosed with lung cancer. As I'm also a smoker, I have been smoking for since I was 20. So he was telling me that it might be a risk factor for this condition.
Okay, and how often do you smoke, and how many packs do you smoke per day?
I smoked 10 cigarettes per day for since the age of 20.
Okay, and do you also drink alcohol or use any illicit drugs?
I use alcohol on only on occasions on parties.
Okay, okay, thank you. Well, that's all I could actually think of for the
Okay,
history.
so all done.
Yes, yes, just stop.
Okay, no problem. It was great for the first time. It was really good, and I will give you the feedback as well. Um, just give me a minute. I want to move to the next slide. So I'm just yeah. Thank you, Dr. Sarah. So, yeah, regarding the interpretation, when the task is given that explain the results to the patient. So, as I have already mentioned, that focus on the task. You don't have to tell to the examiner that I'm going to introduce myself to the patient. You have to directly start communication with your patient. And how to do that? That I am doctor, like I introduce myself as in this way, that I am Dr. Tanveer, one of the physicians in your clinic, and I have your reports with me. And before we begin, do you have any questions or concerns for me? Okay, and if a patient has any concerns, just say him that I will come back to your questions, because you have to focus on your task. You have to explain the results in 2 minutes time. After that, you will not be allowed to explain the results, right? So you will say that I will come back to all of your questions and queries towards the end. And first of all, and I'm going to explain the results to you. So how to interpret the results? Um so F in first of all, I will read out the slides and I will explain how to explain the results. First of all, FEV1 is the max. You have to explain the what is the meaning of FEV1 is the which is the maximal amount of air that you can exhale in 1 second after taking a deep breath in. It indicates the compliance of the small and medium sized airway. It's a measure of obstruction. What is FVC, which is forced vital capacity? It's the maximal amount of air that you can exhale after taking a deep breath in. It indicates total lung capacity. Any disease that will restrict the size of the lung will reduce the total lung volume. It's a measure of restriction. If FEV1 to FVC ratio is less than the lower limit of normal, if FEV1 only has gone down, it's an obstruction. If both FVE1 and FVC have gone down, it's a mixed problem. Just let's take, I will do a quick reading of the slide and I will explain you in a very simple way how you can interpret the result and how will you have to explain to the patient. Reading spirometry is a three-step process. Here comes the job. This is very easy. Yeah, these steps will make your life very easy. You don't have to look into the complexity. You have to break it down in very short phrases to explain the results to the patient. First step is to look at the ratio. The ratio of less than normal gives us two possibilities, either a pure obstruction or a mixed obstructive or restrictive disease. Second step is to look at the FVC, which is forced vital capacity. In our value, it's normal. So it means there is a no restriction, means we have rule out the possibility of a mixed obstructive or restrictive pattern, and we know there is obstruction alone. Third step is to know what type of obstruction it is, if it is reversible or reversible. To do that, we'll look at the measure of obstruction, which is FEV1. We'll look at the post bronchodilator value minus the pre bronchodilator value all over the bronchodilator value and multiply it with 100. If it is more than 12%, it's a reversible disease. If it is less than 12%, it's an irreversible disease. Um, Dr. Saira, can you please move to the previous slide? Okay. Thank you so much. So I will make the job very easy for you how to interpret the results of spirometry and how can you break it down in a very short way to explain to the patient. First of all, you will tell to the patient again that these are the reports of your spirometry, and we have to have a look at some values which are FEV1, our forced expiratory volume in first second, and FVC, our forced vital capacity, which is the total amount of air exhaled at the end of deep inspiration. We have to define it in very layman term, right? So our first step is to look at the ratio. If the ratio is less than the normal range, and in your case I can see that it is 41 instead of the normal range, which is 65 to 84. So we have to look for the two FEV1 and FVC values on separately. If the FVC value is also reduced along with FEV1, which it means either it's a restrictive pattern or mixed pattern, right? So, but if forced vital capacity is more, it is increased, it is always indicated of obstructive pattern. So we have to rule, in this way we can rule out restrictive pattern, right? What is our third step? Then we will check the change in FEV1 value before the medication, before and after the medication. We have to tell the patient that we gave you some puffer medication and we took your results after that, and we need to see the differences in the value of the FEV1. We have certain thresholds for that in order to make our final diagnosis whether it's a reversible pattern of obstruction or irreversible, right? So if FEV1 value changes more than 0.2 liter before and after bronchodilator or 200 ml, it is indicative of reversible pattern, which is asthma, right? If the change is less than that, it means the change obstruction is irreversible, which is chronic obstructive pulmonary disease. It can be chronic bronchitis or emphysema. But this case is a smoker, so most likely it's a case of chronic bronchitis, right? So you have to explain these steps, not more than that, and try to make it as short as I can. Now today I had to explain to you to make it simpler for the patient. That's why I took time. Otherwise, try to practice it more and more, and it will be very easy for you to interpret the spirometry result. You just have to look at the ratio, then the two values, forced vital capacity and forced expiratory volume, and check all of these ratios before bronchodilator. And if you feel that it's an obstructive pattern, then you go to the FEV1 value and also look at the percentage change before and after bronchodilator, right? And look for the change. There are two thresholds. Either FEV1 changes more than 2 increases more than 12%. So in here, the percentage is changed only to 2%. From 41 to it has changed to 43%. So it's an irreversible pattern. So try to be as simple as possible. I know it's hard, but with practice, you will overcome it. So this was the report of spirometry. It can also come as chest X-ray, right? And you have to. It can also come as arterial blood gas analysis as well. So we will guide you how to interpret the test results so that you can perform very well and you are very proficient in explaining the results to patient. And take history. So in this case, already in the STEM, just focus in your 1.5 minute time that the patient already has a history of exertional dyspnea and dry cough for 2 months. So you can rephrase. If you think that you will be able to manage the case in time, you just rephrase to the patient that I can see from your notes that you had a cough and the dyspnea and the shortness of breath. Can you explain a bit further for me? How long you have been having these symptoms? Is it all the time? Is there any specific timing for it? And is it getting worse? Right? Anything that makes it worse? And along with this cough, do you have any other symptoms? Have you ever coughed up blood? Any hoarseness in the voice, any wheezing sounds, and all the associated symptoms related to cough you have to explore, right? Exertional dyspnea. it's very important to rule out cardiovascular cause of exertional dyspnea. It could be that one as well. But you're in here in the stem, in right from the spirometry picture, the diagnosis is quite evident. But still, you have to ask a few questions such as chest pain, any shortness of breath or exertion, uh, any swelling of the feet as well. And your history should focus on the risk factors of smoking, right? Risk factors of COPD, which is smoking and asbestos exposure. Occupation is very important here. And regarding immunization, you also have to ask about the are you up to date with your flu vaccination and your pneumococcal vaccination, right? So and to sub and your diagnosis, your history should also focus in on the complications of your diagnosis, because patient is already having smoking for last 35 years. So you have to ask few quick questions regarding cord pulmonary as well. So this is how it goes. With time, you will learn. That's why that was the main purpose of this case, that I wanted you to expose to exam scenario. You can have a data interpretation as well in your exam, and we will train you how to interpret the test report results. Dr. Sarah, can you move to the next thing? So here are the history questions. Cough, do you have any phlegm? Is it blood tinge? Any color? So you can have a quick look at these notes and your free time as well if you are our student, right? Your rest of your history will follow the same structure as SADMA. We have a useful mnemonic, which is smoking, alcohol use, drugs. You already asked medications, and the medications, and you can also specify based on specific cases, and we will tell you how to do that. Okay, allergies you asked, and the history of the occupation, and the rest of the question you asked, most of them. So you were structured, only you have to focus on the risk factors and the complications of the condition, because the diagnosis is quite evident from the spirometry, right? Dr. Sarah, can you please move to the next one? Yeah. So this is an additional, this is not the part of this case, but it can also come as a counseling case along with spirometry. You don't need to take the history. The task could be given of regarding the counseling. So you have to explain the patient about the diagnosis and be very empathetic. When you explain the diagnosis, just take a little pause. Because of the exams and conditions, you cannot take a long pass, but to take a little pass, explain it to the patient. I know it's a chronic condition, and there is unfortunately there's no cure for it, but I'm here to provide you the support as much as possible, and I will connect you with a lot of support programs designed for COPD management. And this is a very good mnemonic from RSCGP. What is the management? C for confirmation. It's for confirming diagnosis of COPD. We have done this for you spirometry results showing persistent. So the how we had confirmed, there are two methods to confirm the diagnosis of COPD. One is spirometry, second is chest X-ray. Chest X-ray will also have similar some features, which I will in our future sessions I will discuss a chest X-ray of COPD as well. So it has hyperinflated lung fields and these findings which will support our diagnosis, and the diagnosis is confirmed based on the history, physical examination, and the investigations. So these are all important components for confirming our first step, which is our diagnosis. And we have to rule out the cardiovascular causes of cough and shortness of breath as well on history examination and also on ECTs, right? O is for optimizing lung function. So optimize lung function through a combination of smoking cessation, okay, and some medications and buffers to reverse the airway blockage, which are the salbutamol or Ventolin, right? I advise you to completely stop smoking. I can arrange a referral to the quit line to help you quit smoking as well, and do many smoking cessation counseling here. You don't have to do in detailed smoking cessation. It's not a case of smoking cessation. If they will give you case of smoking cessation, it will be included in your task, right? I will also refer you to for pulmonary rehabilitation. It's very important. Its referral is very important here. They have a small respiratory clinics in major hospitals in Australia, and they train the patient how to cope with the situation, and they will have exercise programs as well, such as exercise training and the cuffing techniques to strengthen the respiratory muscles. And they have almost 2 months program, and they are weekly sessions of 2 to 3 hours, 2 to 3 times per day. So they are really helpful to slow down the progress of the condition. And its main aim, our main aim is to optimize lung function. I encourage you to have a regular physical activity so that you can reduce down some of your weight as well. It will also help us in achieving our desired results. I will refer you to specialists who will prescribe you with medications. These are bronchodilator, as already I have discussed, steroids to reduce the inflammation and swelling of lung tissues, expectorants to loosen the phlegm and make it easier to cough up, and oxygen therapy. Expectorants are usually not available. Mucolytics are not available in Australia. So you can skip this part, oxygen therapy and antibiotics. It's a generic management for optimizing lung function, but this is beyond the scope of this case. You can only just mention few steps because these will be the job of the specialist. So you can skip this part. There are certain criteria for oxygen therapy, and antibiotics should be given in case of flare up of exacerbations. Right, there are certain criteria for a home oxygen therapy. If the patient's oxygen saturation is below 92% for longer time, then the patient is a candidate and for that, and that will be decided by specialist for pulmonary rehab program. Right, just to make your knowledge strong, we have included in your slides just to keep you up to date with the information that how is the management of COPD is done. Prevention. P is for preventing deterioration. So how can we do that? Through a combination of smoking cessation, preventing exacerbation, weight reduction, pneumonia and flu vaccination. And how can they can be given? Flu vaccinations are given yearly basis, and pneumonia vaccination, pneumococcal vaccine is given first at the time of diagnosis, second dose at the 12 months, and third one is that 5 months. Oh, sorry, 5 years afterwards. So this is the combination, but you have to break it down into headings. Whenever you explain it to the patient, you have to break it down into the headings, and whenever you move to the next step, just take a pause, say to the patient, are you with me so far? Am I clear to you so far? Do you have any questions for me? So just take a little pause and keep the patient involved. I always say that I will involve you into your management plan. If you had to and you want to have any other concerns, just share with me so that I can help you with that as well. Right? So regarding the develop, D is for develop support. This is very important to explain to the patient, which is COPD action plan. What to do whenever patient has a flare up. Patient should be able to recognize the symptoms of flare up, and they will have to design and they will be aware of their COPD action plan. What kind of medication they can take anytime. Like sometimes if patient is in a rural setting, we can also prescribe a set of antibiotics and steroids or the steroids, and patient should be able to recognize when he can take this medicine. But this is only for the theoretical part. Only you have to explain the name of COPD action plan. You don't have to explain the details of it. Right? I will also refer you to support groups, which can provide education and psychological support. And these are Lung Foundation Australia, Lungs in Action, COPD Foundation Australia. There is a wide set of support groups. X is for managing exacerbations, and I will provide you the reading materials from same lung foundations so that you can come to know how to manage the exacerbations. Just in case you develop shortness of breath that is not improving with the medication, call the ambulance immediately. While waiting for the ambulance, use the puffer at every 6 breaths, 1 puff at a time, and do this every 6 breaths until the ambulance arrives. So this is all for the management. These are the steps of the management. And at the end of the enclosure, always use the mnemonics for 4 hours. Reference, reading materials, review, and red flags. Educate about the red flags symptoms. So this is the protocol to approach a counseling case. So here I covered the history taking part as well and the counseling of COPD as well. Just try to break it down into very short phrases so that you can discuss major points in a very short time. And in the end, always ask from the patient, do you have any questions for me? And I will provide to you the fact sheet from the Lung Foundation Australia just to give you a more insight about the condition. So this is all about this case. Any question? We will come to the questions towards the end of our session. Now, Dr. Kiran will take the next case.
So next, who is going to participate with Dr. Kiran? Let me see. Somebody has raised the hand. Can you raise your hand again so I can? All right. Yeah, I can see you. That's Motorola Edge. It's going to participate with Dr. Kiran. All right, Dr. Kiran, Motorola Edge. Doctor, please introduce yourself. Hang on, I just share. First of all, I'm going to share. All right. Doctor, you are now able to talk. Can you?
Hello.
Yeah, hello,
Yes.
doctor.
Hello.
Okay.
Good day,
May I know
everyone.
the name,
I am
please?
Dr.
Good day, good
Hello.
day. Yeah.
Good day, everyone. My name is Dr. Arpit Patel. I am from India.
All right.
Dr. Patel. So,
Okay.
Dr. Patel, welcome to Emergency Focus. And
Mhm.
so I'll give you 1 minute to read and assess the stem. Just have a brief outline of the case in your head, diagnose it,
Okay.
read the
Mhm.
tasks. My advice is stick to the tasks. Divide your time in such a way that you are able to complete all the tasks. So,
Okay.
so just read the stem, uh, assess whether it is a diagnosis, whether it's a history taking, or it is a management case.
Mhm.
Then make a list in your head what are you going to do and in what sequence,
Okay.
and try not to miss the red flags and try not to use any medical jargon. Okay, so your
Okay, doc.
1 minute starts now.
Okay.
Okay, your time's up. Your 8 minutes starts now.
Okay.
Hello, doctor.
Hello.
I am Mariam, and I'm here with my son Jacob, and he's just 7. He's just 1, and there's something wrong with him. Doctor, please help me.
Okay. Hello. Hi, Jacob. I am Dr. Arpit Patel, an intern in this emergency department. Actually, I would like to ask some questions to you to reach the diagnosis and help you with the management of this. Okay. Is it okay with you? Can we start?
Ye- Yes, doctor.
Okay. Can you please tell me when this episode of seizures came?
Just 1 hour back, doctor. I rushed him to the
One
emergency.
hour, 1 hour back. Okay. Is it the first time?
Yes, doctor.
It's first time. Okay. Does this patient have any fever or something?
No, doctor, no fever.
Okay. When he born, does your doctor tells you that he has diabetes or some problem related to sugar?
No, doctor, he's just 1 year.
Okay. And I know that is there any history of trauma, is accident history
No, doctor.
recently?
No, doctor.
No, no. Okay. After after the episodes of seizure, does he feel any shortness of breathing?
No, doctor.
Okay. So your baby don't have any fever, right?
No, doctor.
Okay. Is there any history of diarrhea or something related to GI issues?
No, doctor.
Okay. Hmm. So, Doc, that's it. What I want to ask in history.
Okay, so in the physical examination, everything is normal. So your in next 4 minutes, you are going to explain the diagnosis to mother with reasons.
Okay. So, from the history and physical examination, I can reach to the conclusion that your child has most probably the seizures called infantile seizures. It usually happens due to any conditions like fever or when the blood sugar level comes down. It don't, but it's normal. It will resolve by its own.
Infantile seizures, is this a term? I think it's infantile colic. Seizures, I
So,
think it is unprovoked seizures.
uh,
Mhm.
yes,
Okay,
yes, right.
with reasons. What are your reasons? Why are you saying it is unprovoked seizures?
Because there is no history of fever also, or no, also there is no history of trauma, and there is no history of hypoglycemia.
Okay, so you ruled out infectious. Okay, let's discuss this as a case. Okay, so Dr. Patel,
Okay.
it was very good for the first attempt, and as I
Mhm.
said that the one thing that is very important for this examination is that you lose the hesitation to speak. When you start participating, that is one step that is almost like 50% impact on your 50% impact on your preparation. So once you start speaking, once you're not worried about what mistakes I'm gonna make, you're halfway there. Okay, rest you just
Okay.
leave it upon us. So
Thank you, Doc.
in the STEM, it's given that it's a 1 year old child. So one thing very important is you have to make sure the hemodynamic stability. Okay, all kids less than 1 year have to be kept for observation in the hospital, no matter what they've come with in Australia. Okay, and it is sudden onset of seizures, and the seizure lasted for 30 seconds. So the timing is given and the occurrence is given, but you still have a lot of questions to ask about the history of present illness, right? Then the child is drowsy right now, the mother is worried. So what you have to do is show a lot of empathy. In pediatrics cases, empathy is the one key thing that you have to follow, because without showing empathy, without reassuring the mother, without proving it to her that you are beyond doubt the safest doctor available, you are not going to clear the case. In peds, it is very, very important. Same way in obs and gynae and psychiatry, confidentiality statement is very important. If you don't do that, they won't speak up. Same way in peds, if you don't show empathy, the mother will not be reassured. She'll keep asking the questions again and again and again and waste your time. Reassure her first. So, first of all, please, it is for all of you. Uh, Please remember one line of introduction for all the cases. You should have one quick line of about how you will introduce yourself to the patient to save time. Remember it, ratify it, practice it 100 times. Don't waste time on introduction, but do it properly. So you must have one line. I am Dr. Patel. I am a resident in this hospital. And how may I help you today? Okay. So one quick line for each case. You have to ratify it and don't waste time on introduction after that. Then, first of all, address the concern of the patient. So you're talking to the mother, address her concern. So how may I help you today? So she'll, like, I started the station. Usually the role player will start the station to save time. So when I started the station, I told you that I'm worried. He's only 1 year old and he's acting weird, or he's making some abnormal movements. What do I do? Please help me. So reassure her first. Okay, ma'am, calm down, please. You have done the right thing by bringing your child here. Please tell me his name, and I'll make sure that he's hemodynamically stable first. Okay, and then, okay, your child is safe now. May I ask you some questions if you don't mind? Okay, then you start with the questions. Now, first of all, put an open ended question. So, tell me what has happened. Tell me what has happened. Now, and then she'll narrate the whole story. And then you ask about the history of present illness. So, is it for the first time? How long has this been happening? Then you ask about what happened during the event. So, what was it actually? Was it some jerky movements? Was there any upward rolling of the eyes? How long was the child unconscious? how long did the seizure last? Because you want to decide whether it was a simple seizure or a complex seizure. So less than 5 minutes, we are not worried. More than 5 minutes, we are definitely worried, right? Then you ask about tongue bite. Any secondary injury happened during the incident? Did the child hit somewhere? Have you noticed any bruises on the body? Then did he wet or soil himself? Any focal abnormalities? Because focal neurological abnormalities are a red flag. So you ask, is the child moving all his limbs properly? Is he able to respond to sounds? Is he having any difficulty in the vision? So you ask for neurological. So you ask for neurological symptoms. Now, once you have asked the presenting complaint, now you go, because it's a seizure episode, you go what happened before the seizure. So before the seizure, did he complain to, did you notice any warning signs? Was he dizzy? Did he take his meals? Was there any trauma? uh, why meals? Because hypoglycemia. So is he breastfeeding? What did he eat before that? How long back before the episode did he eat something? So you asked about fevers. So you can also ask about rash to rule out any infections. Then any triggering episodes. So what are the triggers? So any lack of sleep. Was he able to sleep nicely last night? So is there any other stress going on? Was there any flashing of lights? Was he watching something in the television? Then after the seizure, what has happened? So how did he recover? So the child was drowsy, but he's all right now. It was given in the stem. So is he doing his routine activities after the episode or not? And then you go for the pediatric history. So the general pediatric history would be uh, the Binsma. So in the Binsma, you'll ask about the birth, how was he delivered, was there any instrumentation, how long was the labor, were there any complications, was he hospitalized, and all those routine questions. Then there are some things that you need to rule out. So you have to rule out a brain tumor. So how would you rule out a brain tumor? Is the child losing weight? Is he feeding properly? Is he vomiting also? Or does he hold his heads? Because when children have headache, they just do like this. They don't tell that they have headache, they just do like this. Then you have to rule out any other systemic illnesses, for example, nausea, vomiting, diarrhea, and like that. So, and then you have to take a family history because this is a seizure episode. You have to rule out at least two conditions in the family: epilepsy and febrile seizures. So, any history of similar conditions in your family. So, the patient might say that, yes, oh, yes, his father used to tell me that whenever he had fever, he used to throw fits. You might get a positive family history in the case. And then you have to explain with reasons. Whenever you are trying to explain the diagnosis to the mother, you have to explain it with reasons. So you tell that, I'm sorry, but it seems like it is an unprovoked seizure because I tried to rule out all the causes which might lead to seizure in a 1-year-old child. So you told me there is no head injury, so it is not a trauma. You told me there is no vomiting, so it is not associated with any increased intracranial pressure or headache or hemorrhage or brain tumor. You told me that the child had his meals, so it is not because of hypoglycemia. You told me that there is no rise in temperature or rashes, so it is not because of any infections. The child has no nausea, vomiting, and diarrhea, so it is not because of electrolyte imbalance. So this is how you explain the differentials, and your differential list should be never ending. As many differentials you can put in the case, the better for you. You'll get scored really high. And in it is a tip that whatever the case is, whether it is a history case, whether it is a diagnosis case, differential case, always speak at least one small line in the end. So you say that there can be other causes. There can be cardiac causes. The seizures can be psychogenic. It can be a febrile seizure, which in which you don't get the temperature spike, but still it is due to some infections, underlying infections. So I'll be doing some routine tests. So I'll be sending some blood samples for sugar, for electrolytes, for urine test, for liver function test, for kidney test to check that everything is all right, and to make sure that the baby is safe. Use the word safe again and again and again in a pediatric case. And then, very important, I'll refer the child to a first seizure clinic. Now, this is something that the Australians have. We don't have. This is where this is what is the point that we used to, me and Dr. Mariam were telling about, that there are certain things that happen only there, and you have to be aware about them. So, like COPDX and Lung Foundation Australia, it is something peculiar to Australia. You have to mention that in your case. So first seizure clinic happens in Australia. So you have to mention that. I'll be referring you to a first seizure clinic. You will be talking to a specialist there. He might be a neurologist, and he can order some other tests, for example, EEG and brain scanning, to make sure that everything is actually all right with the child. Now, one line to safety netting. Dr. Mariam was telling about safety netting. So you explain to them the red flags, that what if this happens again? Okay, what if this happens again? So you have to lie the child flat. You don't have to put something in the mouth. You don't have to try to hold the child very tightly. Let the seizure settle. If it happens for more than 5 times, this is the helpline number you have to call the ambulance and get the child to the emergency department quickly. So this is how you approach the case. So now, from what I've explained to you, I've answered all the questions of the mother. The mother came asking, what is happening? You told her it is an unprovoked seizures. Why this happened? Okay, this happens. It is an unprovoked seizure. So there's no real cause. I have ruled out all the causes. I have asked you about this. So the mother is satisfied that the fault is not hers. Okay. In pediatrics, you have to reassure the mother that this condition which her child is suffering from is not anybody's fault. It happens because mothers used to tend, this is where empathy comes in. This is what I'm talking about. You have to reassure the mother that she is doing everything right, the child is in safe hands, and we'll do our best to make her comfortable in this situation. Okay, so you explain to them that there are several underlying causes, but I was not able to find any in the history, so I'll be doing some tests. I'll be sending some samples to make sure that the child is okay. And if this happens again, you have to do this. So now the mother knows what has happened. She knows that what all can cause it. So she'll prevent those things from happening. She'll be regular with the meals. She'll be um, vigilant with the infections and all. And she knows where to go. So she knows she has to go to the first user clinic. And she knows what to do if it happens again. This is how you complete a case. And these are the key points on which you will be marked. Okay. Dr. Saira, is there any other case, or we
Yes,
have to like,
yes.
yeah.
Now we have to. Thank you
So
very much. That
is
was
it time for Q&A now?
yes. This is the time for Q&A, and I would unmute the participants. I'm trying to see if there's option to unmute all the participants. Okay, so if you want to, you can unmute yourself. No, I don't think that they have. Okay, you can ask the questions. I'm unmuting all the participants now. Please make sure that you ask the question one by one, and Dr. Kiran would be able to answer. Okay, anybody wants to ask anything? Yes, Pratik Gupta, please go ahead.
Uh, Hi, ma'am. I'm Dr. Pratik. Actually, I am from India. I'm a specialist here. So I have cleared my AMC 1 exam and I want to later on work in Australia as a specialist there. But then the thing is, actually, I want to get registration as a specialist. So I want to work there and apply for registration. But I will get only the specialist like working rights, right? If I want that I am a GP also, I can work as a medical practitioner. Then I need a general registration, right? And for that I have to clear AMC2, right? So, what's the best way for me to go forward? First, clear AMC2, and then go there and apply for that, or shall I first work towards like my specialist training, file file my papers for specialist registration, and then work like?
Dr.
Can you
Pratik,
help me?
Dr. Pratik, may I interrupt you there?
Yeah, sure,
Sir,
sure.
this is the session for AMC2 clinical learning module. So if you have got any queries for the career pathways, how about you email to us at info@emergencyfocus.net and we would be happy to assist you there. Okay. So if you have got any query regarding the course, the AMC clinical course, AMC clinical exam, would be happy to answer that.
Yeah. My second question relates to that actually. My second question was how many months? Like you said that 4 months is enough, like for AMC2 preparation. And how tough is it to book AMC2 like in face to face? How tough is that? Because I've heard that it's quite tough these days to book AMC2 slot.
Your mic is mute, Dr. Kiran.
Actually, there are two methods by which you can book an AMC clinical exam. So when the slots open, they notify you with their emails. So you can choose a slot at that time. If you are unable to choose the slot, then you can email them and you can give an expression of interest that I was unable to book a spot, and if any spot becomes free in between, then they mail you back that now
Okay, thank
after
you so
1 week
much.
or after 2 weeks this candidate has cancelled the seat, and you can take his seat if you want. The difference is when you book it by yourself, if you're able to book it by yourself, then you know that this is your day of exam. But if you email them EOI and they give you a date, then it will be at a shorter notice. It will be only after 1 or 2 weeks gap, so you have to be prepared for that.
Okay, thank you so much. Thank you so much.
Okay, Dr. Kiran, we have some questions in the chat box. Are you able to see your chat box?
Yes, I have answered 5 of them. I'm trying
All
to
right.
answer
All
more.
right. Okay, no worries. Is there anybody else who want to ask live questions from Dr. Kiran and Dr. Mariam? Please go ahead.
Hi, am I audible? This is Dr. Vishwesh.
Yes, doctor, you are. Please go ahead with your question.
Yeah, I just wanted to know about this course. So you, as I was going through the whole sessions, you mentioned the timings will be Monday and Wednesday in a week, right? And the course will be for 12 weeks,
Yes.
and timings will be 7 to 10 as the Sydney timing, right?
Yes, that's right, doctor.
Okay, so the 12 and what are the dates of the course initiating, and what are the end date? If there is any particular date when the course will start, anything?
Doctor, so the course is going to start on 10th February. On your first session will be on 10th February and it would end 12 weeks time.
And I was unfortunate enough to book the slot during this March examination of AMC2. So I think I'm presuming that the next examination will be from June, July, August. Is that's my understanding. So if we are targeting for June, if we're targeting for July or August, so what will be the precise time that I can join your course?
Yes, Dr. Kiran, would you like, or Dr. Mariam, would you like to respond to that? If he wants to book his exam for July, then what would be
Yeah,
the timeline for exam preparation?
yeah, yeah.
Slots will open for July exam. I think slots are already done till June, fill till June, right?
I think it's March, April, May.
March, April,
Yeah.
May. So the slots will open and you want to book for July. So right now
My
it's
target is as of now for July. So I was assuming if I join the course now, it would be too early for me to
yeah,
in
it will
July.
be perfect for you actually. It will be perfect for you because Feb is approach will start in Feb. So Feb, March, April, and May, and June. Okay, yeah, this course is perfect for you. If you're planning for July, then this is best timing. You will improve as the course goes on. Then you can book trial exams just before your exam, and you can attend the face-to-face physical examination session as well to brush up your examination physical examination knowledge. I think this course is
Okay.
it is a good tailored course
That
for you.
answers his query. So next we have Dr. Danish with us. So we would like to respond to as many queries as possible. Dr. Danish, you want to ask something? Please go ahead.
Hi, good morning. This is Dinesh, and
Dinesh.
I'm from India.
Okay.
So I have a query. I am like planning to give my AMC one by March or May. I'm not sure about it. And me, along with my friends, we are planning to give it together. The question that I have for today is that like after clearing AMC one, before applying for AMC two, we are supposed to clear English proficiency exam, which is IELTS or OET, right? So
Right.
what is the score that we are supposed to have for as a minimum to apply for AMC two? Is it like above 7, 7.58?
Yes, it is seven, more than seven in all, and in the uh, total as well.
Okay. Thank you, ma'am.
Okay, so next we have Dr. Ala. Please go ahead.
Yes, Anil.
Yeah, hello. Can you hear me?
Yeah.
Yes, I can. Please go ahead.
Oh, yeah. I just want to ask, my exam is actually in about a month and a half, and I wanted to see if there is, like, if you guys have any options of maybe like subscribing to like to check the previous videos out, or like, a way of like subscribing to the previous videos and the lectures, like as a way of revision. Do you guys have that option
Yes.
or?
Okay, so Dr. Ala, I'm going to write an email address. Okay, please send in your query and I would share all the previous session videos with you. Okay, it's info at
Okay.
emergencyfocus.net. I hope I got the spelling right. Yep, that's right. So please just write an email and I would send all the previous video links so you can have a look. All right. The free live, not the previous videos of the real course, but the free live session.
Mm. Okay, and is there a way to like a membership for the previous videos, like the course videos?
No, so the guidelines they keep on updating. So the course is really up to date. All right. So we don't offer subscription for any outdated course. They're just for, to get the hang of it, how the course is like and how the AMC exam is like. So since it's been transitioning from an online to physical face-to-face course, so now we are targeting that module, that pattern, that format now.
Yeah, I understand.
Okay.
So you wrote it in the Q&A because I can't see the link.
I
The
have,
email?
no, not the email. I have just mentioned in the chat box. All right. It's the direct message. All right. Okay. To the hosts and panelist. All right. So I'm going to write the email address in the chat box shortly. Okay. So let's move on to our next participant or anybody who wants to ask any question, please go ahead. And I'm going to type in the address.
Any other question?
Any other question? Do you have any other questions? So it's there. Now, can you see, Dr. Ala? I have written the email address.
Yes, I can. Thank you. Yeah. So I'll just send an email there asking
Yeah.
for the
Any other
previous
queries? Yeah, feel free to
videos.
reach us out.
Okay, thank you.
You're welcome. So we have got Dr. Farai. Please ask your question.
Good morning, good evening, everybody. My name is Dr. Farai. I'm calling from Zimbabwe, Africa. I wanted to find out, are there any slots still available for the 10 February group, or you have to wait for the next group to join?
No,
Thank you.
there are slots available. You can register for the course. The course fee is, everything is on the website. Please go to the website www.emergencyfocus.net, and under AMC section, you are going to get all the details, the start date,
Yeah.
and the timings, everything.
All right. It's okay. I've already got a portal access. I did my AMC one with you guys. So
Oh,
yeah,
that's
thank
lovely.
you. I'll do that.
All
All
right.
right.
Wonderful.
Okay, Dr. Pratik has asked in the chat box, which is easier, online or offline. So I don't think there is an option of online available now. It is all offline. You don't have any more online courses available now.
Okay, so our
Okay.
new format, yeah. So our
Thank
new
you.
format of this AMC clinical is more targeted towards face-to-face. So is there any other question before I just end this meeting?
Dr. Anush Patel is asking, what is the course fee? I think.
So everything is available on the website. If you just, I'm going to write the email on the website. It's www.emergencyfocus.net. Okay. So you are going to have a look at the course fee as well. So there's another
Okay,
question.
Dr.
Hello,
Devi,
can anyone hear me?
Yes, we
they
can
will
hear.
not.
Yeah, Dr. Vishwish has a question regarding language exam. So I will make it clear for all of you. If you are applying for the AMC for jobs after AMC 1, so it's recommended to pass your language exams. Um, Even if you are preparing for it, you can mention it in your application that you're preparing for it. It's important to pass language exam in order to apply for the registration, whether it's limited or provisional. So you don't need to pass it before AMC 2 exam. But of course, if you have done it before, it will help you in AMC2 preparation as well. Otherwise, it's not mandatory, right?
Yeah. Okay, someone has asked me what should they do while preparing for AMC 1 that would help them in AMC 2. So I would suggest that you go through the AMC clinical handbook. It will help you with the AMC 1 as well. There are some questions in AMC 1, repeated questions, which come from actually the clinical handbook.
Yeah, exactly. She's right. And for AMC1 as well, I will highly recommend to go through AMC handbook because it's generated by AMC examiners. Even though it's outdated, please go through that at least 2 to 3 times. The concepts which are written in the explanation part will help you. Really, they will help you in the examination.
Excuse me, Dr. Saira. Sorry
Yes.
for asking too many questions.
No worries,
If
no
I
worries.
if I subscribe to the course, to the 8 weeks course, even though my exam is in like 5 weeks or something, like will the previous notes and videos be there already when I
Yes.
sign up?
Yes, they
The
will.
previous notes and videos, they will be there. Okay, thank you so much.
Okay, so in the chat box, I have written, I've just checked the course fee. It's $2,200 plus GST. Installment plan is also available for those who have been asking about the course fee. So I think we are going to wrap this session up because it's been like almost 2 hours. So it was thank you all for participating in this session, and hope you were being able to get an insight for the new format, the AMC Live. It's AUD. Doctor is 2,200 AUD, Australian dollars plus GST. So it was I hope it was very insightful for all of those, and we would be able to transition you from the online pattern to the face-to-face pattern. And yes, like our tutors, thank you, Dr. Kiran and Dr. Mariam, who were there to help you and guide you as you go along your preparation for AMC2 clinical. Okay, so thank you for participating. Goodbye.